Welcome back, everyone, to the Deep Dive. This time, we're going deep, deep, deep into the world of healthcare cybersecurity.
A very timely topic, I'd say.
Definitely. I mean, every time I turn on the news, it seems like another hospital is being held hostage by ransomware or patient data is being leaked. It's scary stuff.
Yeah, no kidding.
But we're not just here to scare everyone, right? We're going to equip you, the listener, with the knowledge to actually understand what's going on. And specifically, we're going to be looking at this recently proposed bill, the Healthcare Cybersecurity and Resiliency Act of 2024. Have you had a chance to glance at that?
Oh, yeah, definitely been following that one closely. Big implications there.
For sure. And we also want to see what the Government Accountability Office, the GAO, has to say about how prepared the Department of Health and Human Services, the HHS, is to deal with all of this.
Right, because they're kind of the ones in charge, right? Making sure that everyone is playing by the rules and that patient data is protected.
Exactly. And it's a big job, especially with how quickly healthcare is going digital. I mean, think about it. Electronic health records, telehealth appointments, everything is online these days.
It's super convenient, but it definitely creates a whole new set of challenges when it comes to cybersecurity.
It does. So let's get right into it. Just how bad is the cybersecurity situation in healthcare right now? Paint us a picture.
Okay, so there's this report, the 405D Hospital Resiliency-Analysis.pdf. Have you seen this one?
I have, yes. Lots of scary statistics in there.
Yeah, it's not looking good. Basically, cyber attacks on healthcare organizations are way up. And one of the biggest culprits seems to be these China Nexus threat groups.
China Nexus threat groups. For those of us who don't speak cybersecurity, what does that actually mean?
Well, think of them as state-sponsored hacking groups.
Yeah.
Super sophisticated, well-funded, and very, very determined.
So not just some teenagers in their basement messing around.
Right. Definitely not. And what's even worse is that they're not just randomly probing systems hoping to get lucky. They're actively exploiting known vulnerabilities. Like, they know exactly where the weak spots are.
Yikes. So like professional burglars who have done their homework.
Pretty much. And the report says something like 71% of these attacks are what they call hands-on keyboard. So it's not just automated bots trying to hack their way in. There's an actual person sitting at a keyboard somewhere actively trying to breach these systems.
That just sent chills down my spine. It's just so hard to imagine an actual person, you know, like scheming and plotting to break into these systems.
Yeah, it's a whole other level of scary. And get this, once they're in, they can move incredibly fast. The report says it takes them just over an hour on average to move laterally within a compromised system.
Wait, just an hour? That's insane. Like, imagine trying to catch a thief who can teleport from room to room.
Exactly. They're in and out before anyone even knows what hit them, and by then, the damage is done.
So let's talk about that damage. What kind of impact are these attacks actually having on patient care? Is this just theoretical? Or are there real-world consequences?
Oh, the consequences are very real. We're talking about delayed treatments, canceled surgeries, even people being diverted to other hospitals because the one closest to them is locked out of their systems.
That is terrifying. It's like something out of a dystopian movie, but it's happening right now.
It is. The report highlights a case in San Diego where a healthcare provider was hit with a ransomware attack. Ended up costing them $112 million.
$112 million. I can't even wrap my head around that.
Yeah, and they had to turn away critical patients because their systems were down.
Just heartbreaking to even think about. And it's not just these big hospitals, is it? Even small clinics and practices are at risk.
Yeah, totally.
Yeah.
The report also mentions a small medical practice in Michigan that had to shut down completely after a cyber attack wiped out all of their patient records. Gone, just like that.
Ugh. It just seems like no one is safe. It really drives home the point that cybersecurity is not just some abstract IT issue. It's a matter of life and death.
Absolutely. And that's why it's so important that we talk about it, understand the risks, and figure out what we can do to protect ourselves.
Exactly. So let's talk about what's being done to address this crisis. We've got this new bill, the Healthcare Cybersecurity and Resiliency Act. It seems like lawmakers are finally starting to take this seriously.
They are, and it's a bipartisan effort, which is encouraging.
Definitely. So tell me, what does this bill actually do? How does it aim to make healthcare more secure?
Well, one of the key things is it establishes minimum cybersecurity standards for all healthcare organizations, no matter how big or small.
Minimum security standards. What does that actually look like in practice?
Well, for one, it would mandate multi-factor authentication for everyone. You know, like when you have to enter a code from your phone or email in addition to your password.
Yeah, I use that for all sorts of things. My bank, online shopping, even some social media accounts. It seems like common sense, especially for something as sensitive as healthcare data.
It does, but it's not always implemented as widely as it should be. This bill would make it mandatory. It also requires HHS to come up with a comprehensive cybersecurity incident response plan. So basically, if and when an attack happens, everyone knows what to do.
Ah, so it's like a fire drill, but for cyber attacks.
Precisely. And the GAO has been on HHS's case about this for a while now. They've been calling for stronger security guidance and better oversight.
So it sounds like there's a lot of pressure on HHS to really step up their game and get serious about cybersecurity.
There is, and it's about time.
I agree. But it's not just about playing defense, right? There are also new tools and technologies emerging that can help healthcare organizations be more proactive.
Oh, absolutely. And that's what makes this field so exciting. There's always something new on the horizon.
Yeah, I like where this is going. What kind of tools are we talking about?
Well, one platform that's really caught my eye is Microsoft Cloud for Healthcare. Have you had a chance to look into this one?
I have, and I'm really intrigued. It seems like it's not just about protecting data, but also about using technology to actually improve the healthcare experience.
Yeah, that's what's so cool about it. It's not just about security, it's about innovation.
Okay, so give me the rundown. What exactly is Microsoft Cloud for Healthcare, and how does it work?
So basically, it's a suite of services and tools designed specifically for the healthcare industry. Like, imagine being able to securely access all of your health data, schedule appointments, even have telehealth consultations, all through one platform.
So like a one-stop shop for all your healthcare needs, but with top-notch security built in.
You got it.
I like it. But how does it actually work? What makes it so secure?
Well, it's built on this really robust cybersecurity framework. You've got proactive risk assessments, advanced security protocols, and they even have comprehensive employee training. It's not just about the technology. It's about creating a culture of security from the ground up.
Ah, that makes sense. Because you can have the best technology in the world, but if someone clicks on a phishing email and gives away their password, it doesn't matter.
Totally. And another thing I find really cool is this healthcare adapted orchestrator they have.
Okay, break that down for me. Healthcare adapted orchestrator. Sounds complicated.
It is kind of complicated, but also super cool. Basically, it uses AI to integrate data from all sorts of different sources and make sure that the responses it generates are accurate and reliable.
Wait, hold on. AI in healthcare. That's a whole other can of worms. We've got to dive into that.
We do, but I think we'll save that for the next part of our deep dive.
Ooh, a cliffhanger. I love it. Okay, well, everyone, you'll have to tune in next time to hear all about the wonders and potential pitfalls of AI in healthcare. But for now, take a moment to absorb all this information about the current state of cybersecurity in healthcare. It's a lot, but it's important. And remember, we'll be back soon to discuss the role of AI and other emerging technologies. See you next time.
Okay, so where were we? Yes, AI in healthcare. Specifically, how Microsoft Cloud for Healthcare is using it.
Right, because you were telling us about this healthcare adapted orchestrator and how it uses AI.
Yes. It's designed to pull together all sorts of data and make sure that the information it's giving back is reliable and accurate, really tailored to the healthcare context.
Okay, but how does it actually do that? Give me an example.
So imagine you're a patient and you're worried about a rash. You log into the platform and start chatting with the chatbot.
Okay, so this platform has like a built-in chatbot.
It does, and it's powered by AI. So you describe your symptoms to the chatbot, maybe even upload a picture of the rash, and the AI analyzes all that information.
Interesting. So it's like having a virtual doctor right there in your pocket.
Yeah.
But how do we know the AI is giving good advice? We're talking about people's health here. There can't be any room for error.
You're absolutely right. Accuracy is key. That's why this platform has these things called healthcare safeguards.
Healthcare safeguards, what are those?
Well, think of them as checks and balances to make sure that the AI is giving accurate information. So things like evidence detection, making sure the AI is pulling from reliable sources, and clinical code validation, making sure it's aligning with established medical guidelines.
Okay, so it's not just blindly trusting the AI. There are systems in place to make sure that the information it's providing is actually accurate and safe.
Exactly. And then they have these chat safeguards, too.
Chat safeguards. Okay, I'm sensing a theme here. What are those all about?
Well, it's all about being transparent with the patient. So the chatbot would have to give a clear disclaimer that it's an AI and not a human doctor. It also has to show where it's getting its information from, like what sources it's using. And there's even abuse monitoring to make sure that the AI isn't being used for anything shady.
Wow, that's really impressive. They've clearly thought this through very carefully. It sounds like Microsoft is really trying to put patients first with this platform.
They are, and they're also using AI to beef up the security of the platform itself.
Okay, how so? Because earlier you were talking about how quickly these attackers can move once they're inside a system.
Right, and that's where AI can really shine. It can analyze huge amounts of data in real time, looking for any signs of suspicious activity, like way faster than a human ever could.
So it's like having a superpowered security guard who never sleeps and can see everything that's happening on the network.
Exactly. And it can also help with things like vulnerability management. So identifying weaknesses in the system before attackers can exploit them. It's all about being proactive rather than reactive.
I like it. It's like having a virtual security consultant who's constantly looking for holes in your defenses and helping you patch them up.
That's a great way to put it.
So it sounds like AI is a real game changer when it comes to cybersecurity and healthcare. But we can't forget about the human element here. You mentioned employee training earlier. What does Microsoft Cloud for Healthcare do to address that?
Well, they have a whole suite of training resources for healthcare workers, and it's not just boring slideshows. They've tried to make it engaging and interactive and tailored to different roles and responsibilities.
So it's not just about teaching everyone the same thing. It's about making the training relevant to what people actually do in their jobs.
Right, because at the end of the day, cybersecurity is everyone's responsibility.
Well said. It only takes one weak link to bring the whole system down. And speaking of links, I wanted to ask about something called network segmentation. I was reading about that in one of the documents, but I'm not sure I fully understand it.
Oh, that's a great point. It's a really important concept. Imagine you divide your house into separate rooms, each with its own lock and key. That's kind of what network segmentation does. It divides the network into smaller, isolated sections, making it much harder for attackers to move around and gain access to sensitive data.
I get it. It's like creating multiple layers of security within the network itself. So even if an attacker gets through one door, they can't just waltz into the next room and grab everything they want.
Exactly. And this is especially important in healthcare where you have different types of data with different levels of sensitivity.
Makes sense. You wouldn't want someone who's authorized to access patient billing information to also have access to their medical records.
Precisely. Network segmentation helps ensure that data is only accessible to those who need it. It limits the damage an attacker can do, even if they do manage to get in.
Okay, that's a really good explanation. But all of this is about preventing attacks, right? What happens when an attack actually does occur? How can healthcare organizations mitigate the damage and get back on their feet? What do they do?
That's where a solid incident response plan comes into play. Like, picture it as a fire drill, but for cyber attacks. It lays out exactly what needs to be done if a breach happens. It helps ensure a fast and organized response.
So it's about having a clear roadmap for what to do when the alarm bells go off.
Exactly. The incident response plan should include things like how to identify and contain the breach, how to gather evidence, who needs to be notified, and how to get the systems back up and running as quickly as possible. And it's not enough to just have this plan written down somewhere. They need to practice it regularly, like doing simulations and exercises.
So like actually practicing the fire drill to make sure everyone knows what to do when a real fire breaks out.
Exactly. And then there's threat intelligence. That's really important too.
Threat intelligence. Remind me what that's all about.
So basically, it's information about potential cyber threats. Think of it like having a network of spies out there gathering information about the enemy.
Okay, I like that analogy.
Right. It's about understanding what kind of attacks are happening, who's behind them, what their tactics are, and what vulnerabilities they're targeting. Healthcare organizations can use that information to be more proactive in their defenses.
So instead of waiting to be attacked, they can use this intelligence to prepare themselves and try to prevent the attacks from happening in the first place.
Precisely.
That makes a lot of sense. But what about insurance? Is there such a thing as cyber insurance for healthcare organizations?
There is, and it can be really helpful, but it's not a magic bullet.
Right. It's not going to prevent the attack from happening, but it can help cover the costs if one does occur.
Exactly. Think of it like car insurance. You still have to drive carefully, but if you do get into an accident, the insurance can help cover the damage.
Perfect analogy.
Yeah.
So cyber insurance is not a substitute for good cybersecurity practices, but it can be a valuable part of a comprehensive strategy.
Exactly. It's all about layers of protection.
Makes sense. But, all of this talk about cybersecurity is kind of heavy. Can we lighten things up a bit and talk about the future?
Sure. What do you have in mind?
Well, I was reading about how AI has the potential to revolutionize healthcare. Not just on the cybersecurity side, but like actually transforming how we diagnose and treat diseases.
Oh, yeah, absolutely. AI is already having a huge impact in areas like drug discovery and development.
Really? Tell me more about that.
So traditionally, developing new drugs has been a really slow and expensive process. But AI can help speed things up dramatically. It can analyze tons of data, like scientific literature, clinical trial results, even genomic information, to identify promising drug candidates and predict whether they'll be effective and safe.
So it's like having a superpowered research assistant who can sift through mountains of data and pinpoint the most promising leads.
Exactly. And AI can even help design new drugs from scratch.
Wow, that's incredible. So AI is basically revolutionizing the way new drugs are discovered and developed.
It is. And it's not just about making the process faster and cheaper, it's also about making it more effective. AI can help identify patients who are most likely to benefit from a particular drug and those who are more likely to experience side effects. It's all about personalizing treatment.
Personalizing treatment. Now, that's something I want to hear more about.
Well, it's all about moving away from this one-size-fits-all approach to healthcare and recognizing that everyone is different. We all have unique genetic makeups, different lifestyles, different environmental exposures. All these things can affect how we respond to treatment.
So it's about tailoring treatment to each individual's unique needs and circumstances.
Exactly. And AI can analyze all that data, your genetic information, your medical history, your lifestyle factors, and help determine what the best treatment is for you.
Wow, that sounds like the future of healthcare.
Hmm.
It's so exciting. But it also makes me think about the potential downsides. What about things like privacy and data security? And what happens if the AI makes a mistake?
Those are all valid concerns. And as we embrace these new technologies, we need to make sure we're doing it responsibly and ethically.
Absolutely, it's a lot to think about. But it's clear that the future of healthcare is going to be shaped by AI. And it's going to be a wild ride.
It is, and it's a journey we're all on together.
Well, I think that's a perfect place to take a break. We've covered a lot of ground in this part of our deep dive. We talked about how AI is being used to enhance cybersecurity in healthcare, and we got a glimpse into the future of healthcare with personalized medicine and AI-powered drug discovery.
It's definitely a lot to digest.
It is. But don't worry, we'll be back soon for the final part of our deep dive, where we'll explore some of the ethical considerations of AI in healthcare and delve even deeper into the exciting possibilities that lie ahead. Yeah, it's a lot to process, for sure. But hey, that's what the deep dive is all about, right?
Yeah.
Giving you the knowledge and tools to navigate all of this complex stuff.
Absolutely. It's about empowering people to make informed decisions about their health and their data.
Exactly. So before we wrap things up completely, what's the one thing you leave our listeners pondering? What's the big takeaway from all of this?
That's a good question. I think I'd ask them to think about this as we become more and more reliant on technology in healthcare, especially AI. What happens when things go wrong?
Ooh, that's a good one. What do you mean by things going wrong?
Well, like what if an AI algorithm makes a misdiagnosis? Or what if a medical device malfunctions because of a cyber attack? Who's responsible then?
That's a really thought-provoking question. It's easy to get caught up in all the excitement of new technology, but we also have to consider the potential risks.
Right, and it's not about being afraid of progress, but about approaching it with a critical eye and asking those tough questions, like who's accountable when AI is involved in healthcare decisions? How do we balance innovation with patient safety and privacy?
Those are huge questions, and it doesn't sound like there are any easy answers.
There aren't, but that's why it's so important to have these conversations. Understanding the complexities of cybersecurity and AI and healthcare, that's how we can advocate for a safer and more equitable healthcare system for everyone.
Couldn't agree more. Well, on that note, we've reached the end of our deep dive into healthcare cybersecurity. We started by exploring the scary reality of cyber attacks, the consequences for patients, and what's being done to strengthen cybersecurity in healthcare. Then we took a look at the exciting possibilities of AI, but we didn't shy away from the ethical considerations either. It's been an amazing journey, and I hope our listeners are feeling more informed and maybe even a little bit empowered.
Me too. It's an ongoing conversation, and we all have a role to play in shaping the future of healthcare.
Well said. Thanks for joining us on this deep dive. Until next time, stay curious, stay informed, and stay safe out there.